allergies.com. It is time now to ask the expert. Here to answer your questions about allergies is Dr. Natasha Bhuyan of One Medical. Okay, so here we go. Jean from Buckeye says, when mucus is green from your nose and cough, is it allergies? That's actually a good question.
Great question, Jean. Okay, there is a common misconception that when people have green mucus, they think they need an antibiotic because they think they have an infection from bacteria. And that's not always true. So green mucus might mean you might have bacteria in your mucus. It could also mean you might have a virus, or it could be from allergies. So if you've got green mucus, it's best to go to a doctor.
I automatically thought it would be a cold or a flu.
Yeah, people think they have sinus infections, but it really could be anything.
Wow, okay. Brian from Phoenix says, is it okay to take allergy meds with a decongestant in them every day?
Every single day. Okay, so we actually tell people use a decongestant only 3 days in a row. The reason why, decongestants have a lot of side effects. They can actually increase your blood pressure, and so they're really only intended to be used short term. Antihistamines, on the other hand, those can be used every single day.
So use the antihistamine.
Use the antihistamine. I mean, ideally use the nasal steroid spray first.
Okay, oh, good to know. Matt from Phoenix says, is it better to take meds or nose spray in the morning or at night? That's
Matt,
a good one.
That's a great question. So the nice thing is allergy meds, whether it's a nasal spray or an oral pill, they last 24 hours. So it doesn't matter if you take them at morning or at night. Now here's the kicker. If you use a first generation antihistamine, so something like Benadryl, that makes you drowsy. So those meds are best used in the evening. But if you're using a second generation antihistamine like loratadine, Claritin, totally fine to use any time of day.
Okay, so nose spray doesn't matter.
Doesn't matter, morning or night.
I was doing mornings. Okay, Casey from Mesa says, can you get addicted to nose spray?
I have heard this. Okay, there is one type of nose spray that can develop a dependence. And so it's basically the decongestant nasal spray.
Okay.
If people take too much of that, essentially their body gets used to it and they need more and more and more and more for it to be effective. So same thing with the decongestant nasal spray, only use that for 3 days in a row. But the steroid nasal spray you can use every day.
Okay, all right. So the steroid meaning like a, what am I thinking?
Like Flonase, yeah, those sorts of fluticasone, yeah, exactly.
Okay, good. Bob from Kingman asked this, can allergies cause a skin rash?
Yes, they can. So we've been talking more about environmental allergens, but there's all kinds of allergens out there. People have food allergies, and they can cause a skin rash, not just respiratory symptoms. If you are concerned about allergies, it's great to get allergy testing done. You can do skin testing with an allergist to figure out what exactly might be causing that rash.
Oh, good to know. Okay, our meteorologist Chris Dunn actually has a question for you.
Yeah, a lot of times we focus on the typical allergens, ragweed, sagebrush. It's medium right now, and especially when the wind starts to kick things up. But what about when the wind kicks up other things? How do we know the difference between allergies and something else like valley fever?
Oh, Chris, you should be a doctor. Valley fever is a great thing to think about. It causes a lot of the same symptoms that we talked about earlier. Cough, nasal congestion, even fevers and fatigue. And oftentimes, people don't diagnose this soon enough. A lot of people think they have got a cold or even pneumonia. Now, the difference is valley fever is caused by cocci. That's a fungus. A lot of what we talked about earlier is caused by viruses. And valley fever tends to live in our lungs. And so it's important to ask about that. The way we diagnose valley fever is with a blood test and also doing a chest x-ray. But important to think about valley fever if you're not getting better and you're not sure what you have.
Yeah, okay. Dr. Natasha, that was fantastic. Dr. Dunn, good job too. I appreciate that.